Hi guys, this is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center in San Jose, California. I'm going to present a case study for you guys, a case that came into my office a couple months ago. I've decided to do these short video series because I believe a lot of people suffer chronically with health issues they believe have no help, and hopefully people gain a little insight and information on these case study presentations. The first case study I'll be presenting today is a case of hormonal imbalances and debilitating menstrual cramps. Before we get started, a little disclaimer. This information is not intended to treat or diagnose any condition. This case is provided by the Bay Area Health and Wellness Center for informative purposes only and is not intended to replace the medical advice of your doctor or healthcare provider. Please consult the advice of your healthcare provider for any medical concerns. Every case is unique and the interventions outlined in this presentation do not work for everyone. So the first case of a 27-year-old female. She came in complaining of irregular menstrual cycles with debilitating menstrual cramps. So this patient had had debilitating cramps since the age of 13 that would last her for about 6 to 8 hours every month. The pain was so bad that it would cause her to roll into the fetal position and stay there until the pain subsided, sometimes hours later. If her cycle came on at night, the pain would wake her up at night. Over-the-counter medications never seemed to help, and the patient had never used birth control but was seriously considering it to manage her pain symptoms. Alright, so first thing we did is we ran a comprehensive blood test on her to see if there was any underlying issues contributing to her pain, but everything came back normal there. So we ran a follow-up test. We ran a female hormone panel, and what this is, it is actually a saliva test, and what the patient does is every 2 to 3 days the patient collects a saliva sample in a vial and puts it in the freezer. At the end of a month, the samples are mailed to the lab, and the lab sends me this pretty awesome printout of what her hormones are doing over the course of that month. And what you can see here in this graph is the green line is estrogen and the red line is progesterone. And what we see is we have a healthy spike of estrogen before ovulation, which is normal. And then after ovulation, we have a secondary spike of estrogen here. What's supposed to happen is after ovulation, we should have mostly progesterone spiking and estrogen should be back down to baseline, down in here. And so this wasn't happening for this patient. So she was estrogen dominant in the second half of her menstrual cycle and progesterone deficient. All right. Now, what we did for her? We started her on a liver detoxification support program. Lasted about 2 weeks. Basically, a high dose of methylated B vitamin complexes along with some other herbal remedies to help support phase 1 and phase 2 liver detoxification, mostly to make sure she's excreting any excess hormone buildup that is in her system. We got her started on a supplement support for her pituitary gland, which consisted of maca extract, panax ginseng root, and some other vitamins. And then we also got her on some natural progesterone support. So this was a blend of shepherd's purse, chaste, herbal extracts, as well as a high dose of fat-soluble vitamins A, D, E, and K. After 4 weeks on her next cycle, patient reported 80% reduction in menstrual cramps. She also reported 100% reduction in mood swings and depression leading up to her cycle. 4 weeks after that, so in 8 weeks total from starting the program, she reported 100% reduction in menstrual cramps. So again, my name is Dr. Ernesto Medina from the Bay Area Health and Wellness Center. We do offer free 30-minute consultations for anyone interested in really asking and getting into the deep of their health issues or health goals. For more info, you can visit www.bayareahealthandwellness.com. You can follow us on Facebook at Bay Area Health and Wellness, or you can call our office at 408-755-5710 to schedule your free 30-minute consult. Thank you very much.